Fascia is currently one of the most popular things in the world. In recent years, fascia and Pilates have become very popular in China, but many people just follow the trend without really understanding what they're doing. So what is fascia? You can think of it as the white membrane that wraps around all red meat. That's what we call fascia. It is divided into superficial fascia, deep fascia, epimysium, and endomysium. And it also forms a kind of network. What is the main function of fascia? It's about connection. It wraps around your muscles. It wraps around your bones. Let me show you how fascia moves. When the fascia in the human body moves, basically moving one part affects the whole body. Let me show you again. Many yoga instructors are down here, right? Look, this is fascia. You'll notice that it's a web during any movement, even if it seems like there's no connection to a distant part. In reality, everything is closely linked. This is fascia. You can imagine it as if we've put all the bones inside a human-shaped net. Let me help you understand bones, fascia, and muscles from a different perspective. You can imagine a human-shaped skeleton being placed inside a human-shaped net. This net is the fascial web, and it's made to resemble the human form with the entire skeleton placed inside. If you think about it this way, this is fascia, this is the fascia throughout our entire body. When you watch Thomas teach, he can create a complete anatomical specimen of the body's entire fascia, which is very impressive. This is fascia, and the relationship between them is such that if you pull on one part, it might tug on another area as well. So if you pull here, the diagonal area above will also feel the tension, and you'll get that kind of sensation as well. That's why people say a single pull moves the whole body. This is fascia. Once you understand fascia, you can better understand meridians, better understand biomechanics, and better understand breathing. What is this? This is the bones are not aligned, but flexibility is great. Type it no matter what. Your elder is still your elder. He has excellent flexibility, but his bones are all misaligned. His spinal x-rays show severe twisting. His pelvis is seriously misaligned, and his sacroiliac joints and posterior superior iliac spines are not on the same line. But it doesn't affect doing the splits or the side split at all. So don't tell me that only when the bones are aligned can you be flexible. Even with misaligned bones, I can still be flexible. And what's more, I can have misaligned bones without any symptoms, not even a bit of pain. Whatever movement you ask them to do, they can do it, and they have no symptoms, and their joint function isn't affected. So joint misalignment has no direct relationship with pain, nor can it be equated directly with function or the flexibility of your muscles. It's just that if your joints are properly aligned and your biomechanics are good, your flexibility might be better. However, with joint misalignment, as long as I put in the time, and as long as the misalignment develops gradually and has reached a relatively weak balance, I can be completely symptom-free. Moreover, my function can be normal because I've spent a lot of time stretching. The misalignment of the joints and the protrusion of the intervertebral disc are essentially the same thing. You might see a large protrusion, but there are no symptoms at all because it has gradually protruded over many years. Even though the spinal canal is already taking up a lot of space, the nerves have slowly adapted and avoided it, so there can be no symptoms at all. The same goes for joint misalignment. If every time a joint is misaligned, it immediately causes pain, then the ones who should be in the most pain would be children with scoliosis, right? Because their joints are all misaligned. When two vertebrae are misaligned, we call it a dislocation. But when more than two are misaligned in a row, we call it scoliosis. You'll notice that many children with scoliosis have a significant curvature, yet they don't experience pain. So you shouldn't equate misalignment directly with pain anymore. But if you were normal 1 second and then misaligned the next, that's an acute situation, and it often hurts. However, the pain isn't caused by the misalignment itself. Rather, the misalignment has strained the soft tissues between your bones and joints, which is what causes the pain. This actually has nothing to do with the misalignment itself. But if the misalignment happens gradually, little by little, then your tendons, ligaments, and muscles slowly adapt to it. So even if the misalignment becomes more severe, there might not necessarily be any symptoms. That's why you'll notice that many people who are hunched over like this don't actually feel any pain. You ask him if his back hurts, he says no. It is because the condition has been formed slowly over decades. So his bones are straight and his tendons are flexible. This is actually not comprehensive, as people with crooked bones can still be good at finance. There are also many people whose bones look perfectly aligned on x-rays, but they can only bend down far enough to touch their knees. In other words, people with properly aligned bones don't necessarily have flexible muscles and tendons, and those with misaligned bones don't necessarily lack flexibility. Similarly, people with joint misalignments don't always experience pain, and those whose joints are perfectly aligned and show no dislocation can still have pain. There's no direct relationship between them, just like with breathing. If you step outside the box and look at things, you realize that everyone's core idea is the same. Supporting yourself on your right leg doesn't mean your right side has the function of breathing. It just means you're putting your weight on that side. Having a thicker leg on one side also doesn't mean that side has the function of breathing. You're just training it to be stronger. You're just working on its supporting strength. So the relationship between them is always like this. Now, if you throw a bunch of bones into this net, you can think of it like this. All the bones are floating inside this net. When you pull on this net, all the bones will move along with it. When does this happen? This happens when you're suspended on wires, when you're doing wire work. At that moment, the influence of all your soft tissues on your bones is greater than the influence of your bones on your soft tissues. Do you understand? So at that time, your muscles can't hold your bones in place, and your bones can't provide support to help your muscles work better. So during the process of wire work, what plays a bigger role? It's more about your ligaments, your tendons, and the internal pressure that stabilizes your joints. At this time, the pressure inside your thoracic cavity, abdominal cavity, and pelvic cavity actually plays an even greater role. So how should you understand dislocation? You can think of dislocation as the bone getting lost that can't find its way home. All right. So if you have this kind of understanding, sometimes when you might normally need to use 10 different techniques to solve the problem, you may only need to use 1 or 2. My point in saying this isn't to suggest that bone setting or repositioning isn't necessary, not at all. What I want to tell you is that you can make the process much more efficient. And the reason I'm explaining this is to help you understand why the bone moves out of place, why it gets lost. I'm not here to debate whether it's necessary to put the bone back in place. Of course it's necessary. But many people spend their whole lives doing bone setting and repositioning, yet they never understand why this particular patient always has this bone out of place, or why that patient always has another bone out of place. Why is it that after you push it back, it comes out again? A lot of people just don't understand this. What I'm discussing with you now isn't about whether repositioning or bone setting is necessary. Of course it's necessary. But once you understand this principle, you'll realize that sometimes it's necessary and sometimes it's not. Why is that? Because as long as you get them to breathe correctly, the bone that's out of place will return on its own. So what is it that pulls the bone back when you breathe? It's this web that pulls the bone, which is floating within it, back into place. You can think of it as a spider web. If a beetle falls onto the web, then the tension of the web determines the position of the beetle. Breathing is what moves your entire spine and your whole pelvis. If you find that all of your patients' misalignments are because one side is stuck in the inhalation position and the other in the exhalation position, and the direction of all their bones and joints is due to being stuck in the inhalation position and shifting this way, then even if you realign it, they still won't have proper breathing function. Our bones and joints have several functions. First, after adjustment, the vertical transmission is normal. Second, during breathing, their rhythmic movements can be normal. So the bone you adjust back, the breathing is still stuck there even after you adjust it back. From a purely physical or radiological perspective, it looks correct. But in reality, what you've adjusted is only visually pleasing but not functional because it still doesn't have the breathing function. So it still lacks the breathing function and it will definitely revert. Sometimes we think that after a person's bones and joints are adjusted back, it's because their muscles are too weak to hold the bone in place. This is one aspect. Then some people say, but I didn't do any physical labor and it still shifted. After the adjustment, I was just lying in bed and it still shifted. That's because your breathing pulls it out of place. So it's your breathing that pulls it out of alignment. When you train the bones, the surrounding muscles can hold them in place. In the past, in clinical practice, after adjusting the bones, if there was no muscle training, the stability of the joints was poor. But later, after adding muscle training, it got much better. However, there were still some people who didn't improve. Do you know why? If a person has good breathing function, and it's just that the small muscles around the bone aren't strong enough to hold the bone in place, then after you realign and activate it, the bone can remain relatively stable there. But what if this person has poor breathing? It's not that they have weakness in their stabilizing muscles, but even if they practice Pilates every day, their bones are still pulled out of place by their breathing. So after you realign the bone, no matter how strong you train the deep small muscles, it will still be pulled out of place. This is the difference between the two situations. In earlier times, before there was much training, teachers like Mr. Long were already quite advanced in their research. Back then, he realized that just doing bone realignment wasn't enough. He needed to make it stable and he needed to train. Right after realignment, you can't move around recklessly, so you need to stabilize it. What did he do? He gave water injections. Do you know the principle behind water injections? The idea is that when you inject water, it's like filling your joint capsule with fluid, just like filling your knee joint with water. It helps to expand the subcutaneous fascia by using the liquid inside, increasing the pressure in that area and pressing everything in place. In other words, it stabilizes you through increased pressure. It works by increasing the pressure around the joint right after stomach reduction, making the pressure here greater, which helps stabilize the joint in place. You can think of the process of the injected water being absorbed as promoting the absorption of inflammation in the surrounding soft tissues caused by joint dislocation. Once this inflammation is absorbed, you gradually become relatively stable. However, it works well for some patients and not for others. This is because different schools of thought have their own mechanisms for these treatments. Many people do these procedures every day, but they don't really understand the underlying principles. That's why you might not understand some people. Meat can be stable, but some people cannot be stable when they train their muscles because for the brain, breathing is the boss. Think about it. You train your muscles and you have a private lesson for an hour and you train this for an hour. So what can multi-role muscles do? You only have 1 hour and my breathing is 24 hours. You train for an hour and I pull 25 0 times. Can you beat me? You can't beat me. I breathe 25 0 times a day and I pull this vertebra in this direction. So for such a person, whether you realign the joint for them or have them exercise the small muscles around the vertebrae, you're only temporarily and forcibly holding it in place. It won't stay there. It just won't. It will definitely slip out again. And it's not just this one that moves. It's just that this one moves the farthest, but actually a whole series of them have shifted. This one just happens to have moved even farther. That's why the alarm goes off at this spot first. That's all there is to it. It's just that simple. All right, let me ask you a question. Suppose you have a dog, and while you're walking it, it runs off with another dog and gets lost, unable to find its way home. At that point, you go out to look for it. When you find it, is it easier to drag it back home or to lead it back home? Which one takes less effort? Of course, in special circumstances, if your dog has been hit and is limping and can't move, and you'd have to carry it back. But if you can lead it home, why would you drag it? What am I trying to say here? If a series of bone and joint dislocations are affected by breathing, it's as if the bones and joints have lost their way. They're out of balance on both sides due to breathing, and they don't know how to get back home. So at this point, if you can lead them back home, why would you drag them? Dragging them home is forceful. You're just pushing them back to their original position. Guiding them back home means using breathing, helping them restore their original breathing pattern, and showing them the way home, leading them back. Do you understand? Only when you can't lead them back home do you give them a little push. That is what bone setting truly is. That is what real repositioning means, not just looking at your scan, seeing everything misaligned, and forcefully pushing everything back into place. It's still the same. You still haven't stepped out of this circle. You're still lingering in the world of bones. Because your mind and eyes are filled with nothing but bones, you still haven't broken out of this circle. Whenever you see something misaligned, you just push it back. It's no different from treating the head when it hurts or the foot when it aches, or only training the part that's overweight. The only difference is that before you only looked at the flesh, and now you're also looking at the bones. That's why right now, bone setters and holistic practitioners around the world lack the ability to guide these bones back home, so it ends up being like dragging a dog back home. He doesn't have the ability to lead the dog back home because he doesn't know why these things got lost in the first place. He doesn't know why they can't return, and that's why these problems arise. Why is that? I'm saying that if you look at any profession or any matter from this perspective, you'll be able to see the underlying truth behind it. You'll notice things that are different. This is also why some people, especially in American chiropractic clinics, require patients to go every day. I've studied all the American chiropractic techniques available in China, from the most basic to the most advanced. But generally speaking, I don't give other people the shares. What I can do is guide them to return home, let them go home without holding them back. If you have them come every day over and over, in the end, you destabilize them. Eventually, the natural rhythmic movement, the normal breathing of their spine will be lost. If you adjust them every day, push them every day, they won't know how to move on their own anymore. At that point, even though the pain has changed, why does the pain change? You remember, when is it that movement is determined by the muscles? Once movement begins, the direction in which the muscles move is determined by the bones. So when you forcibly push the bones into a certain position after an adjustment, it's not the result of their natural rhythmic return. In this situation, you end up changing the direction of the muscles, altering their movement patterns, which leads to new compensations. When you develop new compensations, the original point of stress is no longer under pressure, so the pain goes away. But the new pain that appears later is a result of these compensations under certain conditions. It only sends out a warning signal when it has exceeded the limits of its compensation. So the most common issue we encounter when treating pain nowadays is this. After treating the pain in one area, pain appears in another place. You might think it's a different problem, but it's not. It's because you've changed its compensation pattern, so another pain emerges. It takes some time for the body to compensate before this new pain appears. During this period, when things seem fine, you might think the treatment effect is stable, but that's not the case. Whether the effect is truly stable depends on the person's lifestyle after the realignment. If his lifestyle basically involves lying down most of the time, the effect will last longer. But if after the realignment he chooses to run marathons or go to the gym to lift weights, the effect will be short-lived. So the duration of the treatment effect doesn't just depend on how effective your treatment is. That's only one aspect. The main factor is what kind of lifestyle the patient chooses to live. The type of destructive experiment that was done determines how long things will stay in place after you've adjusted them. We should look at this issue dialectically, rather than always relying on x-ray stones can serve as evidence. But that's all. That's why I said something yesterday that many people still don't understand. You can use your eyes to make guesses, but you can't use them to make decisions. Just by looking at an x-ray and seeing that a bone or joint has shifted, you can speculate that the pain might be caused by this misalignment, but you can't directly conclude that the pain is definitely because of this shift. Then why are there so many people with similar conditions who don't feel any pain? Once you understand this principle, you'll realize this. A lot of manual techniques you use to perform actually don't need to be done, because after you do them, you might end up making their breathing rhythm even more chaotic. Because originally, the power of breathing alone could have pulled it back. But when you forcibly push it here, it gets stuck and can't move out anymore. It no longer moves along with the breathing process unless, of course, you're skilled enough to let it breathe while helping it reset at the same time. Why do we perform realignment? We do it so that it looks better on imaging, and so that when the person moves, this area doesn't bulge out. In essence, it's to make it look better from the outside. Looking good doesn't mean it works well. Just like I said, the bigger you train your glutes, the more your hamstrings might get inhibited, and the more likely you are to stand without proper breathing. So these are all examples of looking good but not being functional. The same goes for our realignment surgeries. No matter how perfectly you align and position things, no matter how precisely you place the screws, if it can't move properly afterward, then it's just for appearance, not for function. Whether it's the current medical system, your clinic, or even gyms, yoga studios, and wellness centers, what we're all doing is putting clients and patients into a state where they look good, but aren't actually functional. Realignment just makes the bones look good. So what if the x-ray shows everything is straight? The person still doesn't know how to breathe properly. So whether you realign the bones, adjust their posture, or release their fascia, all of that is only the first step in rehabilitation. Making things look good is just the beginning. Real rehabilitation only truly starts after that. My goal is to make you functional. But in many cases, we stop after just taking the first step. So all we've done is clean up the battlefield, you've tidied up the aftermath, but you haven't stopped the war itself. That's why these issues keep happening. Once you understand this principle, does it really matter whether you focus on bone alignment first or fascia release first? It doesn't matter at all. It's a waste of time. Once you understand this, you can skip a lot of unnecessary techniques. So we really shouldn't just drag a lost dog back home the moment we see it wandering outside. I'm just giving you an example. Once you hear this example, you'll realize how ridiculous such actions are. What we should do more is, if you have the ability, guide the dog to go home on its own. All right, next I'm going to teach you how to position yourself, how to place yourself in a spot that helps the dog breathe better, and how to align its body so it follows the path home, guiding it back.